Okay, so I want to talk to you today about things that you can do to help calm the central nervous system. And so the reason that I want to talk to you about this is because a lot of times in chronically ill patients, we start developing these neurological responses that were originally there as a protective mechanism for us, and but over time they have we've created a neurological rut. We've created a path that has been run over so many times that when we have a response to a trigger that it may be just a little bit of a trigger, we have an over response. We have a hyper response to that trigger. And those triggers can be all kinds of things. They can be emotional or a mental type situation, from traumatic situations with friends, families, partners, whatever can help stimulate or can cause these hyper reactions, or it could be smelling mold or a perfume, or maybe we eat a food that we react overly to. But the idea is that we get an overstimulation from this tiny little trigger, and we need to figure out a way to help calm that nervous system reaction down. So, what are some ways that we can do this? Well, the first thing that I'm going to recommend is that you use some type of vagal stimulation. And there are different devices that you can buy that will stimulate the vagus nerve. The only one that I have experience with is called the CES Ultra. I don't have any financial connection to this device, but it is a device that a lot of my patients used to buy, that I used to recommend in my previous job. And I did find that a lot of my patients had good results with. It would clip on the ears, it ran a 30-minute treatment, and patients found that to be beneficial. But the way that that worked was to help raise the parasympathetic nervous system, which is part of the autonomic nervous system, sympathetic and parasympathetic, the sympathetic being the fight or flight, parasympathetic being the rest and digest. And so if the sympathetic is overstimulated, causing that fight or flight type result, or the anxiety, acute anxiety attack, then raising that parasympathetic can help balance that out. And we do that through vagal stimulation. And so again, there are different devices, but you can also stimulate the vagus nerve by humming, singing, gargling. Those are probably the three easiest ways to do it. You can also do it by taking your toothbrush and very gently, very, very gently, please, stimulating the gag reflex in the back of your throat. That can help stimulate the vagus nerve. You can also do it by shaking. If you shake, you can stimulate the vagus nerve. There's shaking plates. We used to have a device called the power plate, but there are other plates that you can buy that you can stand on and they vibrate, and you can use that as a vagal stimulation as well. But all of those things help to stimulate the autonomic nervous system, help balance the sympathetic parasympathetic to help reduce the risk of these reactions. The next thing that you can do is a neurofeedback brain retraining type program called the Gupta program. And again, I have no financial connection to the Gupta program or the DNRS, which is the next one I'm going to talk about. But I have had patients using each of these different programs that have had good success in calming these neurological responses, retraining the brain so that we don't immediately fall into these neurological ruts. So again, I really like the Gupta program. I've also had patients have good success with the DNRS program. The Gupta program is online. I'm sure you could probably access the DNRS online as well, but there's also a book that you can read, and I believe you can sign up probably through the internet for mentors and whatnot. But both of those programs can be very beneficial for retraining the brain in relationship to these triggers or stimuli that cause this hyper response of the nervous system. The next two things that you can use are one is called the brain tap, and the other one is heart math. Now, both of these are more based on heart variability, but they do help to retrain the nervous system. The brain tap is a pair of goggles that uses lights, and I believe it also does have sound. I don't have personal experience with this, but I do know other doctors who are using it in their clinics and having good results with it. And the heart math has more to do with listening and helping to use different patterns of breathing, I believe, if I remember correctly, to help to retrain the brain and to calm these neurological responses. So these are some things that you can do if you are super reactive, if you're finding that there's less and less foods that you can eat, you feel like you're reacting to water, things like this. These are probably not true allergic reactions. That's an overstimulation of the nervous system, a hyperreaction of the nervous system. So these are some different things that you can try that could be beneficial. So I hope this helps, and please look for my next video.